Hi, I'm Dr. Maurer, a licensed psychologist here at the Medical University of South Carolina and NCI-designated Hollings Cancer Center. Today, we will watch the third video in the BRIGHT program. This video is called Psychosocial Aspects of Head and Neck Cancer. This 30-minute video will talk about many emotional challenges of the head and neck cancer experience. I hope you find this information useful.
Exercising during the post-treatment period can improve how well you function physically and your general quality of life, especially when you're living disease-free or with stable disease. During this phase, physical activity and a balanced diet may help reduce the risk of a second cancer. It is important to balance treatment side effects, such as fatigue, with your level of physical activity. Sometimes an aerobic training program may help break the cycle of fatigue. Other times, it may be better to be cognizant of any physical limitations from treatment. The key is to keep your exercise program simple and fun. Exercise and relaxation techniques are great ways to relieve stress. Reducing stress is an important part of getting well and staying well. Part of survivorship is living through and beyond cancer. It is important to adopt healthy lifestyle habits to improve your recovery process and general well-being. The next video from the American Society of Clinical Oncology highlights the role of diet and exercise in your daily life.
Activity is really important to well-being, and there actually is information that activity during cancer treatment can positively affect outcomes. So you don't want to turn into a couch potato even if you feel really tired and don't feel like getting up and doing things. In some way, you need to look at that as a part of the cancer treatment program.
If you're on drugs like chemotherapy, you're not going to want to eat right. You're just not going to feel hungry sometimes. Foods that used to taste good might taste awful to you. Getting enough fluids in might be hard. So I would always recommend a referral to a nutritionist. There might be a few days a week after chemo where you don't feel like eating, but how do we support you in a healthy way?
Some people find that they're not as interested in food or that their appetite changes. Others will find that food settles their stomach, so they'll eat too much and not often the right things. So it's important to try and pay attention to your diet, to manage it for energy, and to manage it so that you don't end up either losing too much weight or gaining too much weight while you're under treatment. Many times your physician and healthcare team will have a lot of good information about this and can give you a blueprint for how to be active and to eat well while you're under treatment.
I can't stress enough the importance of a healthy lifestyle that includes physical activity and diet, a little bit of exercise, maybe even while you're going through cancer treatment. Any patient going through surgery should at least think about, do I need some physical therapy to get strong again? How do I trust my body when I'm on chemotherapy? I probably am not going to be able to exercise as much as I used to or even walk up a few flights of stairs. But getting help from a physical therapist in advance is something that I strongly support.
What we know about exercise and activity is that it's good for health, and it's good for people who have had cancer's health as well.
There's emerging data that exercise, physical activity, maintaining a good body weight, and nutrition can impact, in some cases, cancer recurrence, and certainly a new cancer that might show up years down the road. After all, you didn't go through all of that cancer treatment to be at risk for another cancer down the line if there's something you can do to prevent or reduce the risk of it. So getting some physical activity, maintaining a good body weight, eating a healthy diet that includes fruits and vegetables and whole grains, all of those are really important.
It also helps you feel better about yourself and makes you feel like you're getting back to the health that you enjoyed before you had to go through the rigors of treatment. So not only is it physically good, but it's mentally good too. The first thing you want to do when you finish treatment is celebrate the fact that you've passed a milestone. But the next thing is you want to get your life back to where it was before you began this journey. And often that involves ramping up your ability to exercise by retraining again. Many people find that they aren't able to be as active as they like to be or should be for optimal health while they're under treatment. And so getting some help with a prescription for a return to health is a really good idea, and people can do that for you as a part of your health team. That includes also good diet and changing your diet. Often after you finish taking treatments, your diet will change as it did when you first started. And transitioning to a healthy diet after treatment is something that a dietitian can give you help with.
Maintaining a balanced diet and proper hydration is a top priority after treatment. Head and neck cancer patients can experience unique nutritional challenges that can be difficult for both the patient and caregiver. This can be resulting from the cancer involving important structures for eating and swallowing and/or from post-treatment side effects. Common problems include lack of appetite, mouth sores and pain, problems chewing or swallowing, dry mouth, or changes in taste or smell. Unfortunately, head and neck patients may have trouble maintaining weight. Oftentimes, a temporary feeding tube may be needed to assist in maintaining adequate nutritional intake. These next two videos will describe nutritional challenges head and neck cancer patients may face and red flags that patients can also watch out for.
I think nutritional challenges are important for everybody, let alone a cancer patient. And then even more so, a cancer patient has a lot of different issues. The cancer is causing them to lose weight. The treatments are causing them to lose weight. So there's a lot of issues in head and neck cancer that aren't really impacting patients with other types of cancers, because the cancer is where you're eating, it is where you're drinking, it is where you're swallowing, and the treatments are there too. So not only do you have impacts from radiation on the saliva glands and taste, you might have surgery on the tongue or the mouth or the throat. Also chemotherapy, immunotherapy can have some side effects in the mucous membranes and the saliva.
After radiation treatments, patient may expect to immediately be able to chew, but there are a lot of obstacles being chewing, swallowing that we have to relearn. And so working with speech will advance your diet according to safety, making sure you're not, risk for aspiration, or you're just not able to chew or swallow appropriate textures or textures that you're used to. So you might start off with a puree diet and kind of working your way through being able to swallow and having supplements to help you along the way orally. So it may take a while to be able to say that you can sustain yourself orally.
Most patients with head and neck cancer will start to experience significant issues with swallowing as it relates to how painful it is. Eating and drinking is not a pleasant experience. They may have severe mucositis, which is inflammation of the tissues of the mouth and throat, which makes eating really uncomfortable. Food may not taste very good. It may have a cardboard taste, it may have a metallic taste, or it may not taste like they think it ought to, which can be really upsetting when you have favorite foods that you're trying to tempt your family member with and it doesn't taste the way that they want it to taste. They may also experience lymphedema, which is swelling of the tissues, and just like if you had a twisted ankle and your ankle was swollen, it would be hard for your foot to move. When your neck or your throat or your mouth is swollen with lymphedema, it can be really difficult to move some of those structures for swallowing to be comfortable and safe. And then you may have some changes in how the swallow works because of where the tumor was and the scar tissue that has resulted from that tumor being radiated. The red flags that we encourage patients and caregivers to look for when it comes to swallow safety is looking for that increased coughing during meal times. Patients who have things try to go toward their airway typically will cough more, when it goes down the wrong pipe. If it's happening repeatedly and meal times are spent with the patient coughing a lot, that can be a real red flag that they're having things get in their lungs, which can potentially turn into a pneumonia. Changes in vocal quality. So if you notice as they're eating and drinking, their voice starts to change and sound more wet or gurgly. That can be an indication that they're having things kind of sit on the airway. That's making it more likely that they're having things aspirate and get into their lungs. If the patient is breathing more rapidly, if they sound like they're getting short of breath during a meal, that can be an indicator that they're struggling to kind of coordinate that breathing and swallowing that we all have to do when we're eating and drinking. Having to chew the food for really prolonged periods of time in order to make it safe enough to swallow. If you're spending, a minute on every bite, meals are going to last a really long time and you're really not going to get all the nutrition that you need. So paying attention to how long a patient's spending with their meal, how long does it take them to get the food down? Are they exhausted after a meal? That may make them more likely as they fatigue and get tired to be careless and not use the strategies that we've encouraged them to use to be a safe eater.
I basically look for weight loss during and post, just because it does take time for treatments to kind of resolve and the issues that you experience during these treatments. So weight management is a big issue. So weekly weights, just to kind of keep tabs on that, whether you should add or subtract. Inability to consume usual intake, whether that's decreased appetite, nausea, pain, or discomfort. Swallowing becomes more difficult, and having problems tolerating tube feeds, whether that's nausea, diarrhea, volumes too much, or discomfort.
Next, we want to share with you a couple of patients' own experiences on getting enough nutrition.
It was a pretty difficult year to ensure that I was getting enough calories and nutrients.
He needed to have enough calories to fight the radiation.
My concern during the radiation was, how was I going to feed him?
It knocks out most of your salivary glands.
It did affect my taste buds.
The doctor at the time of the surgery did put in a feeding tube because he was not going to be able to swallow.
The feeding tube was really his only source of nutrition or hydration for the rest of the 7 weeks.
You just hold the other end of the feeding tube as a little like a funnel, and you can pour it in, and then later you can liquefy some other foods.
So I would make these soups and the puree, every kind of vegetable that I could find.
We did. We got a machine and we were pureeing, I think even chicken.
Yeah.
And you liked it.
It was basically liquid. It was liquefied.
It was all liquid.
All liquefied.
You just have to be sure you're getting enough calories every day, which in my case was 2,000 to 2,500 calories a day.
They also weigh you to make sure that you're not losing weight, because it's going to affect your overall health and the effects of the radiation and everything.
But he also was able to start eating soft things, remember? It would be soft fruit, applesauce.
Applesauce, mashed potatoes, I loved.
Things that were very moist, you were able to digest. And the doctors were correct, and you actually started to gain back your strength a little bit. And at that point, your weight starts to come back a little bit, and you start to get some color in your face, and you see the light at the end of the tunnel.
Now that we've gone over nutritional challenges head and neck cancer patients may face, these next two videos will describe available support options as well as provide a couple of nutritional tips.
It's important to be patient, that eating is a real challenge. And patients feel really isolated when they can't participate in the same level that they used to. They may find themselves withdrawing socially and withdrawing from family activities. Most of what we do is around the dinner table. All of our social activities involve food. So finding ways that if there's something that the patient can take that lets them be a part of those events, I think is very important. Modifying some of the diets and meals that the family's eating to make it more appetizing to the patient, to make sure it's something that's safe for the patient if they have restrictions on diet, encouraging them to try different things.
Make sure you ask for help. Make sure you reach out for your dietitian, especially if there's weight loss, so we can get it from the start and so we can keep on top of that.
I think it's really important for them to use the resources that are available to them. So make sure that you're talking with your doctors about any questions that you may have, reaching out to support groups or other patients that you may know who can give tips or tricks on what's worked for them.
It's going to take them a lot longer typically to get through a meal. That they may do things during the meal that are considered kind of socially unacceptable, and that can be a little off-putting if that's something you've discouraged in the past, is making noises when you eat and drink. And here we are asking people to do those things, to be a safe eater. Some patients may have difficulty with keeping things inside their mouth, and recognizing that's a challenge and trying to set up their eating environment to where it's less likely to be embarrassing for the patient to try to eat. There's some tools out there that we can give patients and caregivers can help them to use that make some of the challenges that they have eating and drinking a little less obvious. And so reaching out to their healthcare provider, their speech pathologist, to find out what tools might be helpful to allow them to eat and participate in those social events. Oftentimes patients will have a feeding tube that they're using during their radiation treatment. The tube can be placed either because they're concerned about the patient needing nutrition, that because it's so uncomfortable to eat and drink, patients may not be able to get in the volume that they need to stay healthy. Other times it's that they're not very safe swallowing, and because they're not safe, there's a concern that they may have food or liquids go into the lungs that they aspirate or even potentially obstruct to where they choke. So those patients will typically have some type of feeding tube, and unfortunately if they're using the tube, they're not using the muscles of their throat to keep their swallowing working well. We challenge our patients that even if they have that feeding tube, that they find something that they're safe to swallow. Primarily because the muscles of swallowing are just like the muscles of any part of our body. If we're not using them, they are going to get weaker. And as they get weaker, once that patient's in a place where they are safe to start eating, or they're wanting to eat because now they're not in pain, or food is more appetizing, then they're going to have all these challenges because they haven't used those muscles. So even if patients are having some difficulty, we're wanting them to sip on water, to eat whatever texture they can safely get. And if they get to a point where they feel like, okay, I just can't do it anymore, it's too uncomfortable, or I feel like things are maybe giving me more difficulty and making me cough more, then you have the tube as a backup. But always try to swallow something so that you don't lose that ability to swallow, because it really is, muscles are use it or lose it. If you're not working those muscles, they are going to get weaker, and then the recovery is much, much more difficult.
In transition from tube feeds to oral diet, it might be a slow process. It depends on the ability to chew, to swallow, because you have to recapture those abilities also working with speech. And then it will depend on what you're getting through your tube versus what you're actually able to intake. So it could be a slow transition, but it does happen. And tastes will resolve when medications work out of your system. And so there is hope. It just takes a while. So patience is a must. Tips for tube feeds: infuse tube feeds slowly into the PEG. Fast administration can cause distress, nausea, vomiting, or diarrhea. Bolus feeds are based on tolerance, so if you have problems tolerating the volume, those can be adjusted, whether it's less volume and more frequent. Adequate hydration is important, and the oral transition is based on whether speech feels it's safe to advance your oral diet. So that comes into play with speech also. So what we would like to do if you are on tube feeds is to transition or substitute your tube feed with an oral supplement and kind of gradually transition you from one can of tube feed to an oral intake of it. And we would do can for can at that point. And then work on your oral intake. Weekly weights are still very important during this process. Tips for weight management or eating after radiation falls under a lot of categories. If you have problems swallowing, I would say choose soft, moist foods. If you have appetite decreased, try to schedule yourself to smaller, more frequent meals. Don't depend on your hunger to trigger you. Try to eat more calorically dense foods or high protein foods. If nausea is the case, the doctors can prescribe something to help kind of manage that, or try to avoid foods that can cause nausea, like spicy foods, hot foods, foods that are more coarse sometimes can irritate your GI tract during this time. Foods that are most commonly tolerated during this time would be like soft, bland foods. Protein sometimes can be an issue, so we do recommend supplements, and just foods that each individual can tolerate.
Really good oral care. I mean, that's probably what I emphasize most with patients. Much of the discomfort they experience is because the saliva they make is no longer thin and cleaning, it's thick and stringy, and that can make their mouth more uncomfortable. So getting in there and doing frequent oral care, we really encourage people to use a salt and baking soda rinse. It works better if it's warm. Trying different foods. A lot of times foods don't taste the way they remember them tasting, or that they are appetizing, and family members and caregivers can encourage patients to try different things. They may be very salt sensitive or spice sensitive, and so playing around with recipes, trying different foods, using lots of gravies and sauces and things that help make foods more slippery so that they can slide down easier. Softer foods, things that are a little bit easier to chew and to manipulate in the mouth, so that it's, again, more comfortable if they're having issues with pain. And then lots of water. We encourage lots and lots of drinking, because water, if they are having issues with swallowing, is typically the least harmful thing for them to try to swallow. If they are having issues with things wanting to get into their airway, it's benign. It doesn't have anything in it that would be harmful to the lungs, as long as they're doing that really good oral care. It allows them to continue to practice swallowing, even if they're not eating, and using a tube to help them meet their nutrition. And it helps with that dry mouth and thick mucus, because it gives them something to help thin and swallow, so that they keep those muscles working. One thing I ask all of our patients to do is to practice swallowing. Again, we want to use those muscles so that we don't lose their function. If they're not safe to eat something, then after they do a mouth care, the saliva that's there to practice swallowing their saliva. And we want to find something that patients can be safe to swallow so that we can make sure that they maintain that function. And I think that's universal. And we want them to do the most challenging food or liquid or texture that they're capable of doing.
Hi, that concludes the third video in this 5-part series. I look forward to seeing you next week for the 4th video. When you are done, please close the video and click on the video icon on the iPad to connect back to the program coordinator.